The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem.
Welcome to Talk Tuesdays, brought to you by My Virtual Physician, a direct-to-consumer, multi-specialty telemedicine company that operates in multiple states. Welcome, everyone. Thank you for joining us today. My name is Stephanie. I'm part of the team here at My Virtual Physician. We are a direct-to-consumer, multi-specialty telemedicine provider operating in multiple states. It's Talk Tuesday, and we are back with our weekly educational series, talking with experts, exploring some common healthcare concerns that we see, and hopefully answering questions you may have. Today, our physician expert is Dr. Ginger Coleman, and we are talking about GastroEsophageal Reflux Disease, also known as GERD. So thank you for joining us.
Thanks for having me.
Yeah. So is acid reflux the same thing as GERD?
Sort of. Acid reflux is the same as gastroesophageal reflux, which really just means that the contents of the stomach are backing up into the esophagus and or your mouth, and that's when you get that sort of, acid taste in your mouth. Occasional reflux is completely normal and can happen to anybody. Usually it's following a meal and there's no real long-term consequences or bothersome symptoms, and the episodes of reflux are really just short-lived. GERD, on the other hand, is gastroesophageal reflux disease. So that means someone that suffers from GERD has bothersome reflux symptoms that can result in damage to the esophagus, and their symptoms are typically a daily or somewhat routine occurrence. These symptoms include things like heartburn, regurgitation of food, and sometimes there can be difficulty with swallowing. And some people may only present with something like a persistent cough and nothing else.
So how does reflux or GERD happen?
It's actually kind of a little complicated process, but essentially when you eat, your food starts in your mouth where you chew it up and then you swallow it. And so it goes into this long muscular tube, which is your esophagus. And that tube propels all the food from your mouth to your stomach. At the end of the esophagus, where it connects to your stomach, it has what we call the lower esophageal sphincter. And it's not really like a valve that you can see or anything. It's really just an area in the esophagus that compresses together with a high pressure and keeps all of the stomach contents from coming back up into the esophagus. So when you swallow, that area has to relax and open up to let the food into the stomach. So then when that sphincter weakens, or it's, it doesn't have as tight of a seal as normal, that's when you get the reflux. It just does a really bad job at keeping things in the stomach. And so a lot of people will notice when they lay down that they get this acid, and that's just because they have a weak sphincter.
Yeah. So what makes the sphincter weak or weaker?
So there are some foods that will trigger reflux symptoms in certain people, and the more and more that happens, the reflux will then progress to GERD. Some things related to increasing your risk of GERD include drinking alcohol or smoking, caffeine intake, even chocolate. Certain medications can affect people differently, so on and so forth. But being overweight is also a risk factor for the development of GERD. There have been studies that show losing weight will improve reflux symptoms and frequency, and can be a reason to undergo weight loss surgery if you're obese. Pregnancy will also increase your risk, but usually that goes away after you deliver, thankfully. And you can have something that's called a hiatal hernia. And essentially you have a part of your stomach and that lower esophageal sphincter may or may not be involved with it, but it it's no longer in your abdomen. It's sitting up in your chest through your diaphragm. And so that changes the angle of your esophagus, and that can loosen the sphincter tone or weaken the tone.
Interesting. A lot of different things going on there. So how do I know if I have GERD?
Usually it can just be diagnosed on history and symptoms alone. If you have the usual symptoms of heartburn and regurgitation, and that can usually be treated with a trial of PPIs or proton pump inhibitors. That's stuff like, Nexium, omeprazole, any of those that you've probably heard in a commercial. And those block the acid production in the stomach, and see if that gives you relief of your symptoms. If you don't have the usual symptoms, or there's an indication that something more concerning may be going on, you'll need to have some tests done. Some of the tests include an EGD, or an upper endoscopy, which we'll talk about more next week. But essentially, it's a test where your doctor puts a camera on sort of this long flexible tube in your mouth, and they're able to look at your esophagus and stomach. A 24-hour pH monitoring study, which is where a little probe is placed in your esophagus, and it records the number of times and at what time during the day the pH or the acid in your esophagus changes, how long that changes there, all kinds of stuff goes along with that. But it essentially calculates this score that will kind of determine if you actually have GERD. And then there's also something called a manometry study, which is again another probe, but it checks when you swallow all of the pressures in all the different areas of your esophagus to make sure that you don't have an actual motility issue of the esophagus causing some of the issues, and that your sphincter tone is actually lower than it should be when you have those reflux episodes noted on the pH monitor.
Yeah. You said there may be damage to the esophagus. Is that bad? And what do I need to worry about?
It can be bad. Most people don't have serious complications as long as they're treated. There are some serious complications that can happen if you have severe GERD and don't treat it. You can get a stricture in your esophagus, which is really just scar tissue that causes a narrowing or a blockage, and so you can have some difficulty swallowing or feel like food gets stuck when you're eating. You can also have something called erosive esophagitis, and so that is when the acid causes these ulcers in the esophagus, and then those ulcers can sometimes bleed, but the process of those ulcers healing over and over again, and getting new ones and those healing, that is what actually causes the scar tissue to result in the esophageal stenosis. It causes that narrowing, but the ulcers can also bleed. You may not vomit blood or see bleeding per se, but the blood can be detected in your stool. Obviously, if you were to vomit blood, that would be pretty obvious, and you would need to go see somebody immediately, but you don't necessarily always see blood. You can also get what's called Barretts Esophagus, and this is where the cells in the lining of your esophagus change to a completely different type of cell from all of the damage from the acid. The changes in these cells can actually progress further into dysplasia and develop into cancer. So if you were to be diagnosed with Barrett's esophagus, there's a whole different type of management and surveillance that needs to happen, but it is one of those more serious complications. Sometimes the acid can get into your lungs, and so that's where these people have the persistent cough. They get asthma-like symptoms, but it can result in some permanent lung damage, and as you can imagine, having a bunch of acid in your mouth can damage your teeth as well. So there's a lot of dental issues that can go on also. But like I said, most people don't have serious complications, but these complications are why it's so important to see your doctor and discuss your particular case with them and get treated as soon as possible.
Yeah. Yeah. So then how do you treat GERD?
First and foremost, just talk to your doctor. Everyone is different and should be treated as such. So common things work and should be done, but talk to your doctor and make sure you're treating the correct problem before you start trying to self-medicate. There are some lifestyle things that can help, like avoiding foods that you notice trigger your reflux. Don't eat close to bedtime and try not to lay down after eating. So try eating several hours before you plan on going to bed. You know, if you go to bed at 8 o'clock, you got to eat dinner a little bit earlier so that you're not laying down right after you eat. You can lift up the head of your bed, but it involves more than just sort of piling up pillows behind you. It's more like actually putting things underneath the head of your bed on the floor to elevate it. Just because if you sit with the pillows propped up, you can actually just change the angle of your esophagus and make it worse. So just try to avoid eating before you go to bed. That seems to work the best. If you're overweight, try to lose weight, not only just for your overall health, but like I said earlier, a lot of people have relief of their symptoms after they lose weight. Surgery is an option, but treatment with medication is always tried first because it's the least invasive option. Surgery obviously does not come without its own risks and complications. So at least talk to your doctor about taking a histamine blocker, which would be something like Pepcid, or a PPI like Nexium or Omeprazole, for any symptom relief before trying it on your own. Antacids like Tums can help treat some minor symptoms, but if you find that you're using those a lot, it's time to just go and see a doctor. If you feel like the reflux is getting worse, or you start losing weight and you aren't trying to, or you feel like you're choking, you should also get to see your doctor as soon as possible. You may have something more concerning going on. And if you've been treated and you're still having symptoms, then talk to them about changing your medication or what surgical options might be available, if you're willing to explore that option.
Oh, well, thank you so much, Dr. Coleman. You've given us some great information about GERD and treating it and some serious complications. I appreciate you joining us for Talk Tuesday and telling us what we need to know about it. For everyone else joining us as well, this has been Talk Tuesday with my virtual physician. If you'd like to talk to one of our board-certified physicians about your health concerns, including GERD, you can check out our website at www.myvirtualphysician.com. We look forward to talking with you again, and we hope you have a great week.
The information presented in this podcast is offered for educational purposes only. Presenting it is not intended to and does not create a provider-patient relationship between any presenter and anyone else. About the medical topics addressed, presenters provide general information only, not diagnosis or recommended treatments or any other information specific to any individual. Listeners are encouraged to see their own healthcare professional about all topics addressed on Talk Tuesdays or for any other medical problem.